program requests for applications. And 2, authorizes the individuals serving as first selectman or their successors to sign the grant application, to sign any other documents associated with administering the grant if awarded, including any amendments thereto.
Second.
Resolution's been made and second. Is there a discussion?
Gary, you mentioned the total cost was forecast to be up to $350,000?
That's correct. That includes a capacity analysis and NEPA review.
Okay,
So
so this.
I'm just requesting a capacity analysis because I don't believe we're going to have to find other monies to do the
Okay,
environmental review.
but we're applying for the maximum here.
Yeah, that's correct.
Okay, all right, thank you.
Cool.
Further discussion? Hearing none, all those in favor indicate so by saying aye.
Aye.
Anyone opposed? Motion carries. Next item is a special appropriation of up to $505,717 for the Care Hair Clinic. Mr. Scheer will pass out something. As you know, on July 2nd, we heard a presentation for the Care Hair Clinic for our employees and their dependents. This will begin a cost shift and savings in our overall budget for the benefit of our employees. In year 1, we will engage in getting employees comfortable in using the clinic, and as such, identify patients for preventative care. In year 2, we'll begin disease management and bend the cost curve with a 4% reduction in claims spent. You have in front of you what Bill said, 3 possible locations. We'll discuss that. And then we have an analysis that the finance director will help me go through so that you understand the savings. And I have a phone number for someone for Care Hair who prepared the analysis or assisted in preparing the analysis to go through this. But in essence, as a recap, we are self-insured, and you have the analysis. Let's look at the Care Hair on-site medical clinic analysis in front of you first, which is in your packet.
Mm-hmm.
That's this item here. And Ann, if you come up to the podium, and we'll kind of do this together. We are self-insured, so we will incur these costs. And so what you see on page 1 of 7 is the total medical cost in year 1 and the total savings if we use the Care Hair Clinic model. And just as a recap for people who may be watching or listening for the first time, the Care Hair Clinic is based on a cost efficiency model in which the town operates subcontracts and operation of a clinic through the folks at Care Here. Doctors and nurses are then hired in a location that's figured by the town, and then our employees will get to go there, and the savings to provide the service are figured to be less than the savings that would be out in the marketplace that our town has to pay because we are a self-insured municipality. So we would then save the difference between the cost of service provided here and the cost of service provided elsewhere. And then this really goes to managing health care versus sick care in the second part of the model, in that we would ask our employees to do a health risk assessment in which they would be measured for any potential health risks, and then the savings would be borne through the community in cost avoidance, where a wellness coach works with the employees to make sure that if they're borderline diabetic or some other high blood pressure or something, that the doctor then works with the employee to make sure that they're back into a healthier state. And so the cost avoidance is that of a higher cost medical procedures or treatment. And Anna, do you want to go over this particularly, and the cost that we would pay for anticipated, and how these cost savings were figured?
Sure. If you look on page 4 of 7, it goes through a 5-year analysis, and it itemizes in each of the years what the projected medical claims savings will be, what the pharmacy savings will be. And in year one, we included as a productivity savings. Beginning in year two, you'll notice that we begin to see savings for wellness, case management, and health risk assessments. Because primarily in year one, we're looking to get our employees and dependents to begin using the clinic, and we identify individuals who may have conditions that we would want to engage them in disease management. So in year two, you'll see that we begin to see savings for those efforts. And so if you look in year one, the projected savings is approximately $250,000. It increases to about $400,000 in year two. In year three, we're seeing a savings of $642,000. In year four, $900,000, and in year five, we're getting up towards $1.2 million. And below that is indicated what the estimated annual marketplace cost would be for the services that we're projecting the savings for, and then below that you see what the annual total cost for the services through the clinic are.
Now, included in that analysis is the item that Mr. Scheer passed out, which I want to explain to you while we have it. There are 3 potential locations. We thought initially of adding on to the senior center, building something, but then in discussions and listening to the board at the meeting, we thought we'd make a little more conservative effort to try to get this in as cheap as we can until we are sure that this is going to work. So each of these 3 models that you see represents a projected lease of these office space located at the 436 Main Street is the little building up behind the Frosty Treat. Used to be a chiropractor's office. It's on the end of Hague Avenue, the one-way coming out across from Crescent Point. And the cost to remodel and measure and remodel and refurbish the interior and the exterior, and then the monthly rent, the estimated utilities with the total monthly cost, and then the total year cost. The total added up together equals the 41, and then you add up the annual cost of rent because the refurbishing costs would not exist in years 2 and 3. So at a 3-year model, which we're looking at to try to move this through so that we can get a good price on the lease, then and also get the opportunity to get the employees fully engaged. Then Flanders at 131 Boston Post Road is, you'll see that if you go to the second page, you'll see the actual location of the 436 Main Street, and some pictures behind that, 2 and 3. If you go to the 4th page, you'll see the overview of the location of 131 Boston Post Road. This is the preferred area, I think, for me because of the location of the high school. Most of their employees that will, the majority of the employees in the town are at the high school, and it's relatively convenient to the rest of the employees here. And that is a layout that you see underneath the picture. And then the 3rd model is in the Midway Mall, and we're showing that because we showed that to you in previous discussions. But I'm not sure that that's, the right way to go at this point. The cost of build-out is the highest at this point. So for the cost of the difference of the approximately $3,500 between option Main Street and option Flanders, we're getting a lot more bang for our buck in option Flanders in terms of location, in terms of size, in terms of space, inside the rental. And so those numbers were figured in the numbers that you're asked to appropriate this evening, which is the cost of the annual cost plus the number. And so that's been included in this number. Won't be a new cost. And I don't know, Ann, if you have to go over what we anticipate our healthcare costs to be in this. Did you already talk the marketplace cost being $679? Is that?
Yes, I went over that sheet.
And you just want to just touch on how that is arrived at, that number, that 679, that's based on?
Okay, so if you go to page 2 of 7, there's 2 blocks of information. The first block deals with clinic operation year 1. And at the time that the cost and savings analysis was prepared, we had 496 employees participating in our traditional health insurance plan. And based on that number of employees, in the first year of operating the clinic, we're expecting, the estimate is that there would be approximately 2,155 visits to the clinic. It also notes that the appointments are set up in 20-minute intervals, and we would begin by having the clinic staffed for 16 hours a week. And so the bottom section talks about the cost and the savings in year 1. So the first column, marketplace cost, you'll see over on the left when the information provided by our health provider was submitted, the estimate was that the cost per visit was $176.55. So for purposes of preparing the marketplace cost in this example, that current year cost was increased by 4% and multiplied by the 2,155 visits. So the marketplace cost for those visits would be $395,694. The next column is the care here cost. And so the cost for the doctor is estimated to be $135 per hour, the nurse's cost being $35 per hour. So you multiply that by the number of hours that we indicate we're going to have the clinic open for, which is approximately 16 hours a week. And for the analysis, we use a 50-week year, leaving time out for time off, I guess. So the care here cost is $157,874 for the same services that we priced out in the marketplace. So the savings with using the care here model would be $237,820. That's for the office visits. And then the pharmacy costs are projected to be about a 50% savings, which would be $88,235. The pharmacy costs, if you go to page 5 of 7, which is the medical data collection page, you'll see in the first column, the breakout of the prescription costs is $1,069,000. So for purposes of the analysis on page 2, 15% of that estimate is used with a 10% inflation, which in the marketplace would be approximately $176,000. So the projected savings used for pharmacy would be $88,235.
So we have a self-insured model that we're going to be paying out. We have an opportunity to shift to a health model versus dealing with a sick-only model, and to try to do this cost avoidance over time. You have authorized me to sign the contract. I have not signed the contract yet because once we do, there's triggers in the contract to begin a payment schedule, and I wanted to bring all of this to you before you, so that, I can sign it and make sure that we can meet the time dates. And that's the reason it's not been signed, but it has been approved by the attorneys, and Ms. Collins has been involved in this from the beginning, and can, ask any questions. As you know, back in July, we made the copies of the contract available for you to review. So what we're proposing this evening is, this is a model that the healthcare is, our health fund, which has how much money in it, Anna?
We have adequate resources in our health insurance fund to be able to absorb the cost of the appropriation requested this evening.
And the savings would just generate right back into that, because they simply wouldn't come out of that once we got this model up and going. We would pay for the startup costs, and then once the first year savings would be just simply money out of that account that would not be spent. Am I saying that right? Because we would spend this money through claims anyway if we didn't do this.
That's correct.
Yeah.
We would actually spend more,
We would
because
spend-
the marketplace cost is greater than the clinic cost.
Right, so by doing this clinic and movement, which is why I feel so strongly about this, and I've been working on this since January, when I went to Nashville and toured the Care Hair corporate offices and 2 of the clinics. I think that this is definitely a model that should be adopted, not only from our town, but throughout the state. And I think people will catch on board to this. So that's what we have in front of you. And as I said, if you need questions specific to this analysis that Anna can't answer, I have a telephone number to call for Care Hair. So I open it up to the board for questions or comments.
Do you want a motion on the floor before we discuss this, or you want comments now?
Sure. No, we can have a motion. That's fine.
Let me do that then.
Makes more sense.
I move to approve a special appropriation of up to the amount of $505,717 from the Health Insurance Fund for year 1 of Care Here clinic operations, and send to the Board of Finance for approval. This is to include operations, supplies, rent, utilities, and facility build-out. This item will need town meeting approval.
Second. Motion's made and seconded. Now, discussion.
I was not present when the vote was taken, unfortunately, to approve this, and I would have voted no. I have been very skeptical of this from the beginning. I suppose I became even more so having attended a session at the Connecticut Conference of Municipalities talking about the implications of the 2015 requirements of the Affordable Care Act. I have 2 problems. One, I think the whole structure and administration of healthcare, particularly on the municipal level, is still very much a moving target. Listening to one of the superintendents, I think there are a whole bunch of things coming down the road that are going to affect us. I did speak to the first selectman and spoken to the Board of Finance. One of the recommendations was that a joint meeting be convened between the Board of Ed, the Board of Finance, and our insurance administrators to discuss this going forward. My second, and I suppose more visceral objection is I simply don't believe the town is in the business of running a clinic. I look at the projected savings, and they are just that, projected. I understand there have been changes to the insurance carrier. I know why we've made them, but I also understand there is some disquiet on the part of town employees. And a clinic that's open 16 hours a week, assuming the take-up that you have, I'm just not convinced that people are going to use this. I also think projections based on making people behave better and keeping themselves healthy are just that, projections. I lived with someone with a chronic disease. He knew every day what he was doing when it was wrong. People are people, and you can lead the horse to water, you can offer the best things, but I cannot vote in favor of this tonight.
Thank you. Anyone else like to discuss?
Yes.
Ms. Hardy?
As you are aware, I did not vote for this initially, and I do not intend to vote for this evening. I would put a a motion on the floor to rescind our previous action for the contract, but that requires a 2/3 vote, which I know I would not be able to get. There are no other New England offices available for this. We were not provided with any actual track record for any of the other facilities that are operating. The figures are based on 100% employee participation, and we did not have any request from any of the employees for such a service. This is, I think, as you look through the proposal, this is asking for $500,000, never mind putting money into a building which we do not own and which we would not recoup our costs from if this did not work. This is a minimum 3-year commitment by contract, so we're legally bound by this unless both sides agreed to opt out, that it was not successful. We have a contract with the VNA for nursing services. I don't know how this would impact that contract, whether we would have to renegotiate that. I think the prime concern, based on 100% employee participation, and we have not had any kind of a survey to precede this, any kind of survey to the employees as to whether they would use these services if they were provided. There are equipment and supplies. These are to be purchased by the company itself. We have no control over what they purchase, how much they pay, whether they go out to bid on this. And furthermore, in the contract, there is a clause that if their initial cost for setup exceed the estimation, we're responsible for paying the addition. They guarantee that increases in cost of living would be no greater than 4%. That's better than what we've been giving our employees. They have not been receiving that. If we decide that we're going to terminate this, we have to pay for costs of closing up the clinic. If we want to keep any of the records that they have, we have to pay for the electronic transmission of this. As I look at what we are required to pay, it says $29 per employee per month. It does not say per employee participating. It's $29 per employee per month. If occupational services are required, we have to pay over and above for that, and also for setting up for those services. Any additional traveling expenses that are required, any special visits that are required for administration, travel, any presentations, any conferences, we have to pay extra for those. There were some other things I had that are in the contract that caused me some concern, but I think that I've made my point, that I personally do not feel in good conscience that at this time this is the best deal for the town. I respectfully disagree with you, Mr. Formica. I do not feel that this is a move that we should be making and that we should be taking on the responsibilities and the liabilities for medical services. And I completely agree with Ms. Cheeseman's remarks about the problems with Obamacare and complying with those requirements and agreements. People who are in the business professionally full-time are having trouble keeping up with this and the requirements. What's required for computer input, record keeping. I just don't feel that we need to take on this extra responsibility and liability. Thank you.
Thank you. Anyone else like to speak?
What's the PEPM cost?
Per employee per month.
Okay. So this assumes, obviously, we have the same number of employees all the way through. And that could go up 4% per year?
That is the cost to care here for managing the program, and at the original presentation, it was represented that once they have contracted to run a clinic, they have typically left that cost at the same point that it was when the clinic began.
That $29 per employee is fixed for 3 years under this contract. I think the 4% that Ms. Hardy was referring to, in fact, I'm certain that the 4% that Ms. Hardy was referring to would be the cost of living increases for the doctors, for the doctor and for the nurses on staff.
I understand, okay, that makes
Employees.
sense.
But that $29 is based on 100% of the employees, regardless of whether they use the service or not.
That's correct.
Thank you.
For
Anyone
now,
else?
yeah.
I'm going to abstain from this, as I am a member of someone who's going to end up either looking and using this. My biggest deal with this was the $496 number times basically $30. It's just my gut feeling that I don't even know if we get a third of the people to come forward and use it, based on just seeing what they do now, and how things go. So I think it's a huge nut at $500,000 to get the thing up and running, and then and the infrastructure with some of the costs. But as far as my vote tonight, I will be abstaining.
And all the numbers in here based on 100% participation? What are we basing these savings on?
I think if
The
you could
saving-
just,
oh,
if you
this-
just review the numbers, that we're paying out $679,000. With this model, we would not be paying out $679,000 if there were 100% or 20%. The numbers, let's assume it's 100% proposed inclusive. You're paying $453 versus $679.
That's correct.
So if 20% of the 100% use it, you're still gathering the savings based on the estimated 100% using. You're still
Well-
saving $226,000. Now, we are not operating the clinic. Care here is overseeing the clinic. We're subcontracting that in a way for us to save money in healthcare. And if we don't start looking at healthcare in a different way, the Obamacare that's coming forward is going to, in 2018, charge us a 40% premium tax on premiums that are luxury tax on premiums that are in excess of a specific number. In this case, it's in the low 20,000 per employee, and we're almost there now for families.
It's 10,500 per employee and 27,750 or something like that for families. So,
For
yeah,
families.
we're
And
already
so-
at the level.
So we are already at the level. So the way that we cannot get to that level is to try to reduce our claims, because these premium costs that we charge our employees or pay are a function of our claims, because we're self-insured. So if our claims are less, the premium costs can be either moderated, stabilized, or reduced. And that's real. If we don't, then we're subject to annual increases that will sure as hell make sure that the town will be subject to that premium tax.
But I mean, it's, as I say, given the
Now,
uncertainties about the law, there may not be a premium tax. We've seen changes in Washington. My feeling is things are in too much of a state of flux to enter into something that's going to last for 3 years when we don't know for a fact. Let's say we have 2 employees use it. You could make the point that we're saving money.
We are.
But
But the
we've
fact of the matter is we're
invested
not-
$500,000 in this and tied ourselves into a 3-year deal in an industry, a provider network, whatever, where we have no idea what's going to happen. If this were a year from now or 2 years from now, maybe it makes sense. And I think Ms. Hardy makes a good point. If we could we have partnered with the VNA? Do we talk about combining with other towns? Do we do it with Waterford? Do we do it with Lyme and Old Lyme? So we're covering the costs and make it available